Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline is where we'd like to help you live a healthier, happier, and pain-free life. In today's conversation, joining us is Dr. Wyche Coleman III and Dr. Christopher Shelby with the Willis Knight Eye Institute. Thanks, guys, for being here.
Yeah, thanks for having us.
Always good to be here.
Yeah, always love having y'all. So cataract surgeons and Dr. Shelby, we talked a lot about your experience from having
sure
cataracts.
Did.
That was pretty fun. We can definitely unpack that again, too.
I almost forgot about that.
Oh, yeah.
And you did the surgery. So
I should remember that one. Yeah, that was a high pressure day for me.
Yeah, I would love to hear from your perspective too, because we talked all about what it was like for you, which is really cool because now you get to relate to all your patients and what it's like to actually have the surgery for those that are apprehensive. But you know, you can also talk about what it was like.
Well, you know, it was a little bit of a high pressure deal. I've done enough of them now that I'm pretty cool. But I have to say, I was a little bit nervous, you know, doing Shelby. I'm flattered that he, you know, thought I've gotten to a point of skill that I could do his cataract surgery. But we've decided for the second one that I'd rather not know about it until like right when we're going to do it.
Okay.
So we have no time to think. So what we'd like for him to do is show up, you know, on a Friday afternoon when I operate, and he's just going to slip in as the last case, and they're going to be like, oh, by the way.
Yeah.
So
You're doing Shelby today.
How long did you have to prepare for the first one?
We thought about it for what, maybe 6 months or something like that?
Yeah, we did. We kind of went back and forth, and you know, those symptoms were just getting to the point where they were just annoying. And we went back and forth. And he actually texted me one day after surgery on a Monday, and he's like, hey, if you're free, come do a pre-op. And I was like, yeah, okay, I'm free. And I think it surprised him. And so
I was like, boy, this is on now. I guess we're gonna have to do it. So that was my highest pressure surgery. It's my life. It gets me prepared for my dad. You know, I have to do my dad's cataracts at some point, maybe pretty soon. That should be easy after doing Shelby's. But
I know, when we talked, like you didn't want to be like a backseat driver during it, so
I don't think I said anything.
He didn't give me too much coaching.
Yeah, not too much. But I wanted to be, like I was telling you last time, I wanted to be awake enough to remember stuff.
Right.
But like I told Coleman, I wasn't going to not take anything, you know. And like I said, I wanted to be just sedated just enough that if we were at karaoke, I'd go ahead and sing, you know. And of course, I don't sing, so. But it was great. I mean, it's a little fuzzy, but the whole process, it really is cool. You know, patients tell us it's like a kaleidoscope, you know, it's like a psychedelic light show. And it really was. I mean, it really was cool. But the neatest thing is I did not feel a thing as far as, you know, pain or discomfort. You know, you feel water, you feel a touch here, there, some pressure, but it's not anything more than like if you rub your eyes or something like that. It really was amazing.
Yeah, and so it's the light show in the eye that's being operated on, right? So what's the other eye doing? Is it just?
It's closed. Of course, you're not worried about that one. You know, and you're looking, the lights of the microscope are really bright. It's interesting what your brain does when you're looking at a bright light. You actually, or at least what I saw, were like, you know, black circles, almost like, you know, when you see an eclipse, you know, and so you've got the black in the center and you've got some lights coming out from the side, and that's what you're looking at. There's 3 of them, and then there's like this swirled pattern. It really, if I was an artist of any description, you know, you would draw it out afterwards. What I didn't see that some patients talk about are some of the colors that they've never seen before, you know. And I was actually kind of looking forward to that, but I did not see that. I did not see those, but I did see the swirls. And then it literally is, you know, and of course, I was aware enough to know exactly which steps, because he would talk to me, you know, during the thing. And and then it was over. It was done. So, and one thing I can tell you to do is after you have cataract surgery and the sedation, do not get on Sam's app and start shopping.
Why is that?
Yeah, because I still have a bunch of stuff at the house that I probably
didn't need.
I don't need, but at the time,
shopping spree.
You know, my
From
wife
the
and
sedation,
my wife and daughter took me up there, and then, you know, brought me home. They had to go run some errands, and I was like, man, I feel great. This is wonderful. You know, I'm checking my vision, and I'm like, oh, we need some paper towels, and then next thing you know,
Now you got 50 cases of paper
yeah,
towels.
we got 50 cases of paper
comes by the
towels.
house.
If anybody needs some dude wipes or something, let me know.
Oh, we love those. The blue ones?
Yeah,
those are great.
Those are great.
Fantastic.
We'll bring you a few cases.
Yeah, no,
All
really,
right.
don't buy any for a while because I got plenty.
That's so funny. Great. Well, glad it was a good experience. Y'all are still friends and colleagues, and
Yeah,
well,
good.
I mean, I
got
figured
fired.
I could move in with him because I know where he lives. And, you know, so something happened, I just moved.
so
right
you'll
in.
end up doing the next one, right? Like you said, but you just don't want to know.
Yeah, and he didn't need the other
Yeah.
one done very bad. He had an injury as a child. Did y'all talk about this before?
We did,
He got
yeah.
shot with an
Trauma.
airsoft gun, so it was sort of a traumatic cataract. He didn't need it too bad. You know, it was still had okay vision, but it was interesting to hear how much better he said it was afterwards because, you know, we see cataracts that don't look too bad. People say I'm doing fine, but the visual improvement subjectively was real dramatic for him. And of course, he held perfectly still. I have to give it to him. There was no movement at all, so he was very cooperative, and that makes it easy. So that's
that
great.
a common thing that happens during the procedure where people move around? Or
Yeah, some people have a tough time holding still. You know, sometimes they fight from beginning to end. It typically goes well either way, but it does make it easier on us if somebody can hold still and look straight ahead. That makes it super easy. You know, people always say, you know, I prayed for a good outcome, and I said, well, make sure you pray that you hold real still too, because if you can do that, we're probably going to have a good outcome.
Okay.
That's a key component of it. So, but most people do fine. We can give them as much sedation as they need. We had another interesting experience because we have a fellow that works with us for a year who's a fully residency trained ophthalmologist that's spending a year to get some more experience in refractive surgery, and so he needed a LASIK. He's been wearing contacts. He's about a -2, you know, a little bit nearsighted. He's wanted LASIK. And the other day we said, sort of off the cuff, sort of like he'd do in his surgery, I said, well, why don't we just do it tomorrow? And so we did LASIK on him, and he did it with 0 sedation. Sometimes we give Valium. I'd taken him for an aerobatic ride in the airplane, and he was totally chill. This guy he's just kind of a chill guy anyway, but he was totally cool on that. And he said, well, how much Valium should I take? And I said, well, I don't know. You seem pretty cool. I don't think you need anything. I think you can do it with nothing. And I think that it'll be easier for you to stare perfectly straight ahead. And so he did it with no sedation at all. You know, it was 2010 that afternoon. So, you know, 2 or 3 hours later, perfect vision. It's sort of like Shelby in his cataract surgery. He says he felt nothing, literally nothing.
Even with no sedation?
Other than a little water flowing, just drops hitting the eye, even with no sedation, absolutely 0 pain. So it's interesting to hear that from people who do it for a living. You know, that perspective is fascinating to me.
Yeah, right. So
yeah, it really, you know, it is truly amazing. And of course, you know, it's a blessing and a curse to kind of know what's going on.
Ignorance is bliss.
Yeah, ignorance truly is bliss, but it also is where a lot of the fear comes from, you know, from most patients with that first eye. You know, everybody with that first eye, they're excited, they're anxious. And when they come in, you know, the sedation works very well. And then most of them afterwards say, oh my God, that was nothing. And so for the second eye, they're very excited.
Yeah.
You know, and going back to what my correction was before surgery, you know, our results are so good, and we've done so many of these, that I thought to myself, why would I wait any longer for better vision? And it goes back to any patient who's listening who's been told, oh, well, you still see well on the chart, but their symptoms are just annoying them, you know, because I corrected to pretty much 20/20.
Almost 20/20.
Yeah, almost 20/20. Now, it wasn't crystal clear. I could read the line. Of course, I memorized most of them. But, and like I've said, it's just the distance vision is better than it's ever been without correction. And so that's why, you know, I can talk to patients now and recommend it. They're like, am I ready for it? And I'm like, well, how bad are those symptoms bothering you?
Yeah.
And those that are like, God, it's annoying, glare at nighttime, trouble reading small print, things like that, there's really no reason to wait other than the fact that you just don't want to have it done.
Yeah.
You know? And so life's too short for blurred vision.
For sure. Yeah, I love that y'all say that reiterating the quality of life. If it's impacting your quality of life, then you really should, you know, just take the leap, and you'll most of the time feel a lot better and be glad that you did it. Yeah.
99.9% of the time or something. You know, I don't want to present anything that we do as a 0 risk proposition. You know, we've talked about this before, how confidence in doctors has gone down. I think that was a result of bad advice giving during COVID mainly, but it went from 70% to 40% in a 4-year period. We shouldn't assume that things have no risk. We shouldn't present it as that. It's not 0 risk, but you know, when it comes to eye surgery, you know, LASIK, cataract surgery, those risks are very, very low. I mean, that is the reality. You know, people say, I'm worried that I'm going to go blind from having the surgery. You are statistically more likely to die in a car accident driving to or from the surgery than to go blind from it. So it has gotten to a point where the technology is excellent, it's extremely safe, and there's a very high probability of visual improvement, even if you're just having mild symptoms like Dr. Shelby was having.
Right, right. Yeah. Well, if you're just joining us and you have a question for Dr. Shelby or Dr. Coleman, we're talking about cataracts and really anything else related to the eyes. We'll kind of shift gears here in just a little bit, but if you do have a question, give us a call. That number is 318-219-4569. It's right there on your screen too if you forget it.
Well, in the meantime, hopefully somebody will call. We'd love to have callers. We may touch on dry eyes for a minute.
Yeah.
You know, I think I've talked about this before on the show. I think dry eyes is like a little bit overdiagnosed. There's probably too much talk about it. But some people
many
really
commercials too.
So
about it,
many,
yeah.
you know, so many. And I think it's overblown. And most people just have mild dry eyes. And a lot of people just don't close completely when they sleep. And if your eyes are open 1 millimeter at night, dries out all night, those people, if they can just lubricate the eyes at night, it'll resolve all their problems. But there are a subset of people who just don't produce a high quality and a high enough quality of tears. And you've got 2 layers to your tear film. You've got a watery component and you've got an oily component. And the watery component is 2 microns thick. It'd be like smearing water on my boot there. It would evaporate in like a few seconds. And that's how thick your tear film is. The reason it doesn't evaporate instantly is because there's an oily layer sitting over the surface of it. And as we get older, we produce a lower quality of those oily tears. You know, if you look at a newborn baby, they can stare at you for like 5 minutes without blinking. And that's because the quality of the oily component of their tears is so good. It looks like, you know, gasoline on a pond. You can see the oily layer on their eyes. As we get older, that oily layer gets lower quality. That oily layer is produced by meibomian glands, which are the glands that are around the margins of your eyelids. And it decreases over time. So that is the thing where your eyes start burning if you don't blink. I get in front of these bright lights, I'm 45, and I feel like I have to blink too much. That's probably because my oily tears are not as great a quality as they were when I was younger. There's a new thing called IPL, intense pulse light, and it's a great treatment for that. And it's been around for a little while. We just got one at Willis-Knighton, and the results have been really good. And it's a non-surgical. You don't have to take a pill every day. And basically, you take this intense light and you go deliver it with a little probe around the meibomian glands. It produces a little bit of heat, but it causes them to produce a better quality of tears. So especially people who have a poor quality of oily tears, it's really effective, and it's painless. It's easy to do. So that's something that we haven't had in our toolbox that we do have now. That's pretty nice for some of those people that are annoyed by dry eyes.
Now, do you recommend this if those the lubricant that's over the counter, if that doesn't work, or if they're just tired of using it?
I'd always try that first.
Yeah.
Yeah, it's kind of a stage thing. So, you know, you want to try the lubricating drops and ointment at night first. If that works, great, you're good. If that's not working, then we approach, you know, medical therapies like Restasis, Xiidra, some of the eye drops for dry eye, but that's usually to treat underlying inflammation. And if you've done all these things, you've had plugs and your eyes are still dry, then it's a good idea to let us take a look. And we actually have a keratograph now. We can actually image those meibomian glands to see how healthy they are. We can evaluate the rapidity, how fast the tears evaporate. And so based on that, then that can lead us into the therapy. And the IPL does work very well. And like Dr. Coleman was saying, you know, that oily film should be like olive oil. Like when we squeeze those glands, it should be the consistency of olive oil. But what happens is we do the intense pulse light, we actually express the glands, and it literally is like toothpaste. That doesn't work. And one of the ways that the oil is expressed is every time you blink, it creates pressure. So it's literally pulling the oil from the glands itself. Well, that can't do that. And over time, it just gets drier and drier. And of course, I'm slightly older than Dr. Coleman. So like when I'm driving and if the air is blowing at me, you know, your eyes kind of burn, sting, and they water. That's because they're evaporating very rapidly. Gotcha. And it actually works incredibly well. And the patients we've done so far who have tried everything else, they love it.
Awesome. And is this something that will last a long time, or will that patient need to come back and have that therapy again?
You do usually group a few treatments 2 or 3 weeks apart at the beginning, and then you see like a maintenance every 3 to 6 months after that.
Interesting.
To keep it up. So it's pretty cool. My sister and Dr. Shelby's PA, Sable, are the main ones doing that. Have you done it? No, I had it done on me the other day. So
yeah, I have had it done. It is pretty cool. It does not hurt. Actually feels.
It's kind of like a hot stone massage of your eye.
Yeah,
I would say.
Yeah, it's like an eyelid massage.
It's like a spa day.
Spa.
Yeah. I don't have many spa days, so.
Yeah, I mean, I have 0, but I guess except for that one.
Yeah, so it is repeatable. It's pretty cool. My sister, Sabor, doing it. We've also added this Forma treatment, which is a radio frequency thing, and that's nice for bags under the lower lids. That's a common complaint, and there is 1 million treatments for it. There's commercials about that too. If any of them work, there would only be one.
Mm-hmm.
Yeah, so none of them work that good. And it's really because it's a structural problem, and you're trying to fix it with some sort of remedy on the surface of the skin, but the underlying problem is actually in the orbital septum. So that's a piece of collagen, a thin piece of tissue that holds the orbital fat back in your orbit. And as you get older, it just gets looser, just like skin and everything else. Gravity works on it all the time. And that allows that orbital fat to bulge out just a little bit, and that's the reason you get bags under your lid. So basically this radio frequency applies a small amount of heat there and causes that orbital septum to tighten back up some to reduce the bags under the eyes.
Interesting.
Works really well. It's a better, and the other solution is a lower blepharoplasty. Some people need that, where you need to go take a piece of skin out and then sew it back together. But that's a little bit more invasive, so I think this is worth trying first. Mm-hmm. It's a pretty cool thing, and it's non-invasive, low risk, easy to do. Takes 5 minutes.
Okay. One thing kind of similar to the topic of dry eyes is if someone wears contacts every day, do you feel like those patients typically have drier eyes because of the foreign object in their eyeball?
Yeah, and usually that's just from contact lens wear.
Mm-hmm.
You know, we see this thing where people are chronically dry. You do LASIK, they're not dry anymore.
Mm-hmm.
Yeah.
Everyone becomes contact lens intolerant at some point in their life. If you wear them long enough, you know, proteins build up on them, your body reacts to that. You can wear them for a decade or two, but at some point people don't tolerate them well. Tear production goes down and you're just sensitized to them. You can sometimes change contact brands and kick the can down the road a little bit, but it's rare for people to be able to wear contacts for, 30 or 40 years without having any sensitivity to them.
Interesting. Yeah, and if they sleep in them, then that can really cause some damage even more quickly. We've talked about this before.
Yeah, not good.
That's the worst thing somebody can do, is sleep in contact lenses. And they're like, well, I've done it before, it's no big deal. And it's one of those things where, it's no big deal until suddenly it is. And when it is, it can be devastating. Some of these Pseudomonas ulcers can actually penetrate through the cornea within 24 hours. And then, like one of my daughter's friends, I did LASIK on one eye, PRK on the other eye, because she had such a dense scar on one eye from a corneal ulcer secondary to sleeping in her contacts. And she actually did very, very well. But I mean, that could be a blinding situation. And if the ulcer is big enough, then they would need a corneal transplant or some therapy like that. And so don't sleep in your contacts.
Yeah. Okay.
It's an interesting comparison. Like with LASIK, I like to break things down into numbers and give people the actual numbers of what the risks and benefits are. And I break LASIK down into two separate categories: safety and efficacy. Safety first. So if you're 20/20 or better with your best glasses or contact prescription, the probability, if you add up all possible complications from LASIK, infection, epithelial ingrowth, inflammation, every horrible thing that could happen, the probability that we're going to permanently decrease your vision by 2 lines or more, meaning going from 20/20 or better to 20/40 or worse, that's the driving cutoff, and you can't make it better with glasses or contacts, is about 2 per 1,000. By extension, the probability that that's going to happen in both eyes and visually disable you as a result of having LASIK is about 4 per 10,000. Okay, 2 per 1,000 is pretty low. That's the risk you have to be okay with in order to have LASIK. If you compare that to someone who sleeps in their contact lenses, they incur that risk every year. So at 1 year, a contact sleeper has a 2 per 1,000 risk, at least, maybe slightly higher, of having 2 lines or more of permanent irreversible vision loss. Those are the people who get an infection, and it's right in the middle of their visual axis, so they now have a scar that they're looking through. So for a contact sleeper, LASIK is an absolute no-brainer. It's way safer than sleeping in your contacts. If you take someone who doesn't sleep in their contacts, who takes them out every night and handles them perfectly, that risk of 2 lines or more vision loss occurs at 5 to 10 years. So no matter how you use your contacts, over a decade period of time, LASIK is certainly safer. That's been proven over and over again.
Right. Okay. And when do you suggest someone consider LASIK if they are, someone like me that wears contacts? When should they consider it if their eyes are progressively, still changing? When is that window to kind of consider that surgery?
18 is the FDA cutoff, right? So that's 18 and older. We generally like to wait for 21. So when somebody's 21 years old, generally their eye has stopped growing. And everybody will come in and say, well, there's been a little change here and there, but that could be a change up and down. It's like this year I was a little more nearsighted. Next year I'm a little less nearsighted, but it's plus or minus about 5% of the prescription. And as long as there's been stability, generally 21 is good. 18 will do it if somebody's going in the military or has some sort of extraneous situation. We'll go ahead and do it at 18 with the understanding that there may be a slightly higher risk of needing an enhancement, beyond 21. But the sooner the better. The younger they are, the more good vision they have to look forward to.
Yeah, right. Okay. Yeah, so that's something to consider if that's, if you're
But if you're, people who are 30 or 40 shouldn't say I've waited too long.
Yeah, right.
You can still do it then. Those people should be stable. And the common question is, how long is this going to last? Well, if you're a -3 or 4, you're moderately nearsighted. Even if it drifts a little bit over a period of decades, you're never going to be that nearsighted again. So maybe if you need to wear a pair of glasses to drive at night 10 years from now, and you're -0.5 or some small prescription, it can drift a little bit. But in general, when you get in your mid-20s, it's not going to change a lot after that.
Yeah, well, that's good to know. Yeah, and any person that would be maybe a candidate for the PRK over LASIK, depending on what's going on.
Well, I mean, a lot of it. There's a number of factors that we look at to do PRK versus LASIK, and it used to be thinner corneas with higher corrections we looked at, but now that we know more about the corneal mechanics, most everybody is a candidate for LASIK or SMILE. A few of them, depending on lifestyle, like a lot of our special forces, the military, we generally do PRK on. But that's actually fallen by the wayside too. We're now able to do LASIK on our fighter pilots, helicopter pilots, things like that. So it just depends on the patient. And like I said, generally the patients that I end up doing PRK on are those that have some corneal scars, or there may be an issue with us creating a flap or being able to do the SMILE lenticule on them.
Gotcha.
PRK has become very, very rare in modern times, because now when you have somebody with a thin cornea and you say, well, we're worried about making this cornea too thin, most of the time with those people, you'll just do an implantable contact lens, the ICL, where you put a thin lens in the front of the eye. So those end up falling into that box, and that's probably a safer, better alternative to PRK if you're real worried about the corneal thickness. So those would be the people who did not pass LASIK screening before. And really, if somebody comes in the clinic and they're over about a -8, if they're very nearsighted, and LASIK would have been an option before and would still be an option today, we really lean in the direction of doing the implantable contact lens, because it's reversible. It takes 5 minutes to do it. I think on the lower corrections, LASIK is still absolutely the standard. But at some point, you just don't want to alter the shape of the cornea that much and take that much tissue when we have the option to just go put a lens in the eye, which works great.
Yeah, talk about that, the ICLs, and it's kind of a newer than maybe LASIK, or?
It's a little newer. They've been around for a long, long time in multiple iterations, and technology's gotten better. The current version's been in Europe for about 10 years. The FDA is the last to approve anything, so it's been here for about 3 or 4. The EVO lens, it is great. I waited to do it until we got this one, because we knew from the European data that it was super safe, extremely effective, very, very, very low complications. So since we started doing it, it's amazing, because you can do people who are ultra nearsighted, who are like a -20. That's a huge prescription. Their glasses look like the bottom of a Coke bottle. And so that's a life-changing deal for them. As we've gotten more experience with it, we've gotten more data, now we're expanding that into the people who are not quite as nearsighted. So I think somebody who comes in and has a low correction, they're going to go with LASIK. If they have a super high correction, they're going to go with an ICL. But that cutoff point is moving, and ICL is getting better over time, and that's more compelling.
Interesting. Okay, well, Leroy, thanks for joining us. And what's your question today?
Yeah, my question is about, I don't know now, 10 or 11 years ago, I had cataract surgery, and my vision has decreased probably even worse than it was before I had that. And I'm wondering if there is an opportunity to have a new cataract surgery and put in and see if my vision, I can get a little more.
Yeah, that's a good question, and it's actually a very common question. And 10 or 11 years ago was a while back. for cataract surgery. And the first part of that answer is it's usually kind of difficult, and we don't like to go in and take the old lens out and put a new one in, because we generally can't put any of the premium lenses in after you've already had cataract surgery. But the first order of business is to figure out why your vision has decreased since the initial surgery. Most commonly, we see what we call a secondary cataract, which is just a haze on the back part of the bag that we put the lens in. That's an easy fix to enhance the vision. And then if it's something like an increase in astigmatism, which we do see, the cornea does change shape very subtly over time as we get older. That's another common reason for the vision to change after the initial cataract surgery. And procedures like LASIK or PRK can be done afterwards to enhance vision. So it all depends on what the blurry vision is due to. So the first order of business is to get an exam, and we'd be happy to take a look at you to see what's going on, and then what we could do to enhance it.
I will be making an appointment next week.
All right, great. We look forward to it.
Absolutely.
Great. Maybe a good time to plug the website. It's thecataractsurgeons.com, and then my office number is 318-212-5901.
And then I'm at 212-3937, but you can also call 212-2020. But you can find all that information at thecataractsurgeons.com.
Thank you.
You're very welcome.
Yeah, thanks, Leroy. And yeah, that would be just that information. If you at home also wanted to call in, you guys are always accepting new patients, right?
Yeah, especially people who have had cataract surgery and don't feel like they see as well as they should.
Yep.
Because our underlying theory is that almost everybody should have a great result from cataract surgery, and especially people who had it 10 years ago. Our screening methods are so much better now. The tools that we have in our toolbox are so much better than they were 10 years ago. You can almost always take someone who had cataract surgery and is unhappy with the result and get them to the point where they're happy with the result. And a lot of times it's a real easy fix. And I hate it for the people who've waited 10 years, sort of living in purgatory without a great result that they were unhappy with, because, most of the time we can figure it out. So it's worth a visit to come in.
Yeah.
And sometimes in some rare cases we say, look, your best choice is just to do nothing, wear some glasses. And that's okay. But it's worth looking, because a lot of times we can do something to improve it.
Right, and at least get some clarity on what's going on,
Sure.
And what other options that they have available to
And
them.
make sure it's nothing else, like a retinal problem or glaucoma or something that really needs to be addressed immediately.
For sure, yeah, or we've talked about secondary cataracts. It could be something like that. Does it,
And that'd be the first thing we'd look for
Yeah.
sure.
And those are easy to find.
and easy to fix.
And
Because
easy to
you're
fix.
YAG
And
laser,
painless.
Am I right?
Oh man, you're
Oh,
like,
look at that. That's right.
you only need 3 buzzwords to be an expert on anything.
That's
You're an
right.
ophthalmology expert now, I think.
Yeah.
Thank you.
Surely
That's
by now.
it.
You probably got like 10
Yeah,
or 12 at least.
surely by now.
That's right. You got
Yes.
a lot more. Yeah.
Yes, you could probably teach this class.
I definitely don't want to do the surgeries though.
See one, do one, teach one. It's easy.
That's right. We start with pig eyes. You'll be fine. Yeah.
Oh yeah, I guess cadavers. Yeah. Okay, I forgot to ask this earlier. When you are in the cataract surgery and you're under the sedation and everything, is something holding your eye up,
Yes.
open?
Yeah, there's a
It's-
speculum,
okay.
and actually
Okay.
that is the that's one of the weirdest parts when the speculum goes in, because your eyes numb, your eyelids aren't, so you feel like you want to squeeze against it initially, and I'm sure that's what an alien abduction feels like, but they may not use numbing drops. I don't know, but as
Not
long
the
and
movies, anyway.
here's
Yeah,
the
probably
key.
not.
Here's the key. If anybody's about to have cataract surgery and they're worried about that, just don't squeeze against it, because you can sometimes be your own worst enemy, and so when that speculum goes in, you have that tendency to want to squeeze and just relax,
And
so
that's why the sedation maybe helps.
it
with
does.
that
It's
too.
tremendously helpful, and it's one of those things where we do all the heavy lifting. It's all done for you. Like I said, the key is just looking at those lights.
Okay. All right. Well, that's all the time we have, and thanks for joining us. Thecataractsurgeons.com if you wanted to call in or look everything up and get on the schedule.
Yeah, good.
Yeah.
And we've had a testimony from my most compliant patient.
Yeah,
So-
that's right. I was a pretty good patient.
Yeah.
I used all my
Amazing.
drops like I was supposed to. Also,
Good job. Yeah, good.
We both
patient.
survived. I think it was more stressful on me at the end of the day.
Probably.
I know it was more stressful than you.
Yeah, for sure. Well, love it. Thanks for joining us. This will be on our website. That's ktbs.com/podcast.